Hello, my dear students. Welcome to another online session. Dr. Ankur is here to conduct your today's session, and hopefully, all of you are good and safe. And hopefully, you are seeing my previous session about the sterilization and disinfection. And if you have any query, including today's session, please communicate with me through my phone, mobile, messenger, over phone, anything else. But don't be hesitant. So, so now I'm going to start my today's session. Microwave radiation. Wavelength range from 1 millimeter to 1 meter. It is absorbed by water molecules. May kill vegetative cells in moist foods. Bacterial endospores which do not contain water are not damaged by microwave radiation. Solid food are unevenly penetrated by microwaves. Now, the disinfection to reduce the number of pathogenic microorganisms to the point where they no longer cause disease. Usually involves the removal of vegetative or non-endospore forming pathogens. Chemical used for disinfectant is called as disinfectant. In the first session, I'm already describe you all of the terminology regarding the sterilization disinfection, which enhance you to understand the all of the session. Hopefully, you are know the definition of all of the things, all of the terminology. Now we are discuss about the characteristics of disinfectant. Characteristics of disinfectants are they have wide spectrum, be active at high dilation, be active in acidic as well as basic, have speedy action, have high penetration power, be stable, be compatible with other compounds, not corrode metal, not cause local irritation, not interfere with healing, not be toxic, be cheap and easily available, be safe and easy to use. So if we can say the characteristic is a key point, we have to remember this. It's a wide spectrum, is a high dilation, active in acidity, reaction, high penetration, stable, be compatible, not correspond any metal, local irritation, healing, or toxicity, and it will be cheap, available, safe, and easy. This is the main key point of the disinfectant. Now, the factors that determine potency of the disinfectants: concentration and stability of agent, nature of organism, time of action, pH, temperature, presence of organic materials, nature of items to be disinfected. Now, this is very important slide for all of you, my dear students. So this is a class. Now we are discussing about the classification of these infectants. Number one, based on consistency. Number A is liquid. Example: alcohols, phenols. Number B, gaseous, is formaldehyde vapor and ethylene oxide. Number two, based on spectrum of activity. Number A, high level. Number B, intermediate level, and number C is a low level. And number three is a based on mechanism of action. There is a number A is the agents that damage cell membrane. Number B is the agents that denature proteins. Number three C is a agent that modify functional group of proteins. And number four is a sporicidal agent, butaldehyde, formaldehyde, chlorine, iodine, and iodospores, ethylene oxide, and beta propiodactyl. So when your examiner asks you the classification of these, first you have to tell the heading, and then you'll give the chart and example. Okay, hopefully you are understand my two slides. And the next one is based on the spectrum activity. Spectrum of activity is the high-level disinfection used for items involved with invasive procedures that cannot understand. Sterilization procedure like endoscopes, surgical instrument, example butaldehyde, hydrogen peroxide, paracetic acid, chlorine dioxide, etc. This is all of the example of the high-level disinfectant. Number two is the intermediate level, used to clean surfaces or instruments in which contamination of bacterial spores, highly resistant organisms are not present. Instruments like hydroptic endoscopes, laryngoscopes, anesthesia breathing circuits, etc. Example alcohols, iodophore compound, and phenolic. This is the example of the intermediate level. And the next level is a low-level disinfectant used to treat non-critical instruments such as blood pressure, cuffs, ECG, electrodes, and stethoscopes, etc. Example is a quaternary ammonium compounds. This is all of the example of the low-level disinfection. This is the picture we are seeing. This is the we can now discuss the site of action of the chemical agents. There is the first one is you can say there is a cytoplasmic membrane. This is the number one is the quaternary ammonium compounds because and phenolic and bigonates are working this. And there is in the inside of the membrane we can say there is a proteins we can say and the phenolic, alcoholic matters, halogen, aldehydes, ozone and peroxygen are working to degradation this protein. And another things we are seeing there is a DNA. The aldehydes and ethylene oxide are denaturation the DNA. So we can understand the site of action of the chemical, all of the chemical agents. Okay, we will hopefully we are understand after seeing this picture. Now, on the basis of mechanism of action, number A isn't that damage the cell membrane. Number one, surface active agents. Surfactant that alter energy relationship, producing a reduction of surface, hydrophobic and hydrophilic. Classification, number is a cationic agents act on phosphate groups of cell membrane phospholipids lead to loss cell membrane semi-permeability and leakage nitrogen and phosphorus. And number three, the denatured proteins. Example, septimide, benzalkonium chloride, cetylprimidinium chloride, etc. Its uses active against the GPC non-sporing, lethal to GNV is high concentration used, and fungistatic active against envelope virus. Anionic agents include soap and fatty acids active at acidic pH, active against GPC. Ammonolytic or amphoretic compound known as TEGO, both properties of anionic and cationic, effective agent against GPC and GMB. Now we'll discuss the phenol and phenolic. Phenol carbolic acid was first used by Lister as disinfectant in 1867 years. So destroy plasma membranes and denatured proteins, rarely used today because it is a skin irritant and has strong odor. 1% of concentration at a pesticide. Phenolic are chemical derivatives of phenol. Result, derivatives of cold air uses for contaminated glassware, meaning towards disinfection of aspirator. Chlorhexidine, commercially we are using the Savlon. This is very nowadays it is very important for everyone for this pandemic to disinfect your home So member of the bicarbonate group, this is the chlorohexidine is a group, a member of the group of bicarbonate group, widely used in wounds, preoperative disinfection of the skin. Then is a chloroxylone, active ingredient of Dettol, less toxic and less irritant. Hexachlorophene, biphenyls used for surgical and hospital microbial control, effective against gram-positive staphylococci and streptococci. Excessive use in infant may cause neurological damage. Advantages: stable, persists for a long time after applied, and remain active in the presence of organic compound. Use in hospitals, active against GPC and GND, sporicidal activity, disinfection of pus, saliva, feces, used for discard culture, contaminated materials, used for preservation of sera and vaccine at a concentration of 0.5%. Thank you very much, my dear student. Hopefully understand today's session. This is very important session we are conduct now. So you have to understand everything. So if you fail to understand anything, please communicate with me. So thank you. Thank you very much. Be safe. Stay at home.